car bursted into flames and then rolled down an embankment about 150 feet. Due to the severity of his burns and his broke legs, they decided to call life flight. So he was transported by life flight to a local hospital.
It was kind of conflicting emotions because where he was, I had confidence and trust, but yet we weren't really getting the outcome that we thought we were going to.
We went in to see him as a team. That's really important here at the hospital. We work very closely as a team. So I know there were nurses, of course, Dr. Warner, his physician, myself, I'm a social worker, and I usually like to really be there to help and support the patient and the family. There were also therapists, occupational and physical therapists. I'm not really sure that at that appointment we had nutrition involved, but we knew from some of the history that we were definitely going to have them as a part of the team. And I think we know that one of us working alone isn't going to have the same impact as all of us working together.
When he came to us here at Shriners Hospital in Cincinnati, he was a tough case. He was completely malnourished. He wasn't able to do anything for himself. He couldn't give himself a drink. He couldn't change himself. There was nothing that he could do on his own. He really had lost all hope and even the will to live.
When Brayden came to us here in Cincinnati, he had some significant limitations in mobility and range of motion and strength from a prolonged hospitalization at another hospital. We pride ourselves on the aggressive occupational and physical therapy that we do to return our patients to a more functional level. So some of the things we did with Brayden were to increase his range of motion, specifically to his right hand and to his right hip, allowing him to sit up better and increase his mobility.
I'd say probably when Dr. Warner released my right hip was when I got more hip flexion and was able to actually sit, more than 30 degrees. I actually was able to sit up, do therapy, stretch, so on and so forth. Because before I got my hip released, I couldn't even lift my leg. My scars had just, caused a contraction.
It was good to see, wow, they really have a different approach to doing things, and I've never seen that before, never heard of that before. It's refreshing, maybe this is gonna work, maybe this is gonna help him.
The team here made some very quick devices for him to use a fork, a spoon, brush his teeth, and we were seeing him do stuff on his own within a week of arriving. So.
What was different than the first hospital was I had a feeding tube for 6 months there. Here I had a feeding tube for 2 weeks. In less than 7 weeks I gained 40 pounds. I was going to the team room, socializing with people that were younger than me, people that were around my age.
When he called one night and Donnie put him on speakerphone, his voice, it sounded like the old Brayden before the accident. And I hadn't heard that voice in so long.
Honestly, the doctors are a big difference. Dr. Warner took a chance on me. I was the first hospital's biggest burn they've ever seen. And, coming in here how I was, I don't see what was going through Dr. Warner's head. It's her, I feel like, and everything that she does. And not just her, but, the whole staff that makes everything worthwhile here. Even the cooks in the kitchen, they'll come down, bring you food, and they just have the biggest smile on their face. And, it makes you happy to be in a place where they care so much.
Just 2 weeks prior to us arriving at Shriners in Cincinnati, we were, in him leaving the hospital he came from, he was to the point of filling out his last wishes. Daily he's changing and making strides forward. We're looking forward to seeing him walk again. And that'll be the icing on the cake.
If you saw pictures of me a year ago and you look at me now, it's like, that's not the same person, but it is. And that's all to y'all. That's all because of y'all and the doctors y'all have and my surgeon, Dr. Warner. Thank you for giving me an opportunity to live. Y'all have changed my life tremendously.